Hi everyone. Hi Facebook folks as well. So I'm taping this because about half the folks are missing or they'll show up late, and so they can look at it later. We talked about the fundamentals of homeopathic treatment last time, and today we're going to do practical tips. And like I said, a lot of you have been coming here the last 3, 4, 5 years, and so I know you really well. So I've taken the liberty of putting together remedy pictures for you folks. And we can do them for others as well, but I thought we'd start with a few. And practical tips, again, let like be cured by like. So the principles of homeopathic medicine are almost the opposite of the principles of allopathic medicine, which is you suppress the symptoms and thereby drive the disease far, far deeper. Whereas with homeopathy, you're bringing the symptoms to the fore and stimulating your vital force to cure. And so some pretty good results have been had, and I just wanted to put a few case studies. And if you have watched the last one, you probably know about our dog, Travis. Travis is a wonderful...
You're standing in front of us.
Oh, sorry. Travis. This is Travis. And this is a picture for cuteness. Put up for cuteness. Travis had a water cyst / tumor that was about that big when I started him on a homeopathic remedy. And it has shrunk about 40% in the last 4 or 5 weeks. And it's pretty dramatic for me because he'd had it for the last couple of years, at least couple of years.
Wow.
And he was a very vaccinated dog. Right before we got the dogs, they were heavily vaccinated with a lot of stuff. And so I gave them the remedy Thuja occidentalis 30C, I think once or twice a day in the beginning, and then now once a day. And dramatic relief and reduction in his tumor size.
Wow.
So his name is Travis. This is our second dog that we inherited, and she's very cute too. She's a Shiba Inu mix, and she had rivers of brown gunk coming out of her eyes every single day. So our practice was for me to get up, wipe her eyes down, and then by evening, again, rivers of brown gunk would collect. Not completely, 90% disappeared. 90% disappeared, and she seems to have a lot more life energy. She was very damaged. She was she had seizures. She was having seizures. Her legs were sort of, very wobbly. She runs like the wind now. And so 3 or 4 weeks, and I'm carrying it on until it all goes away, because although homeopathic remedies for acutes are 1 day, 2 day, or 1 shot, for chronic disease, it's a very different picture. And so as I see it going down, I will reduce the frequency and the dosage. I might even reduce the potency, but I'll probably reduce, because I only have 30C. I'd have to go get it. So that's the story of Roxy.
And Roxy also 30, Thuja?
Thuja, because they both were subjected to the same thing. And with dogs, at the vaccination sites, you get these fatty tumors called polyomas, and that is shrinking. And Travis got it, Roxy did not, but his polyomas are shrinking. And frequently, those are what become malignant, and that is why vets know to vaccinate dogs in their rump or back legs, where they can cut off the leg without a problem if it becomes malignant. Yeah.
And one dog that I know was vaccinated with a flu vaccine for dogs, almost died.
Yes. So I thought Thuja was magical enough for me to put it out as a case study. We have a lot of children who are heavily vaccinated, and especially children with autism respond really, really well to this remedy. This remedy picture, vaccinosis with animal stuff being injected into the person over a long period of time, mental symptoms exactly like those of autism, or in adults that are overly vaccinated, chronic disease such as MS, Parkinson's, chronic fatigue, fibromyalgia, and so on. Dementia, yes, absolutely.
As a result of vaccinations.
As a result of vaccinations. And you can see the improvement. They become cognitively better. You can see the changes. Would you like a?
remedy?
That's the remedy. Thuja occidentalis, you might need a lower potency, you might need a higher potency, but that's your gateway to homeopathy med in today's world. Maybe it was not as pertinent 200 years ago when there were no vaccines, but in today's world, this is a great remedy to start with in the event of damage.
No question. So that is for growths in dogs or humans also.
Mm-hmm.
So heavily vaccinated adults, it would it pull out some of the?
Yes, so
Pulls it out.
So basically, what it's doing is it's not doing anything itself. What it's doing is increasing your vital force and stimulating your immune system to push out those toxins in a more efficient fashion.
So humans and pets.
Yeah. And so the question that I'm a very skeptical person by nature, and the question that I asked was, could it be placebo? Because people keep throwing that at you. It's placebo. Sugar pills, your mommy gave them to you, she gave you a cuddle, and you got better. Placebo. Well, my dogs didn't even know I was giving it to them. I was slipping Roxy hers in with her food, and Travis didn't know what he was getting, and they got significantly better. So it's not placebo, folks. This is something called a repertory, and I put it in just so people could understand and appreciate how homeopathy operates. And they're not scared. You all are really smart people. You all know how to read. And a lot of these things were written 200 years ago. Some were written 100 years ago, and some as recently as 20 years ago. And so they didn't know about microbes when Hahnemann came up with the concept of homeopathy. But he knew there were miasms. People got syphilis. People got gonorrhea. People got tuberculosis. And syphilis those days was treated with
Mercury.
Yes,
Mercury.
yes.
That's
So
wonderful mercury.
yeah. So most of the patients who came to Hahnemann were syphilitics who had been treated with mercury and were dying of mercury poisoning. And so for them, Merck Sol really worked well. They got cured of their mercury poisoning and of the underlying condition. So Thuja is the tree of life. It's an North American cedar actually. The tendency of the Thuja patient is to throw out wart-like excrescences. You'll find children with a lot of warts, especially if they've been vaccinated a lot or had several courses of antibiotics. These cauliflower warts, the black, brown ones on your neck, nape of your neck, thighs, belly, cherry angiomas, and so on. So they throw out warts, which are soft and pulpy, much like Travis wart/tumor. Very sensitive, they burn, itch, and bleed easily when rubbed by the clothing, or they're horny excrescences that form on the head. So you have to like reading if you want to indulge a homeopathy hobby. And words like excrescences, who uses words like that now? Form in the hands and split open, form upon a pedicle, crack around the base, cauliflower excrescences upon the cervix of the uterus. On the labia, women get a lot of warts. Thuja, Thuja, Thuja. Women who've been vaccinated with the old poliovirus and the old vaccines that were made from what? The substrate for those vaccines was from the cervix of Henrietta Lacks, a patient with very malignant cervical cancer. So they took those cells, because they were very fast growing, and used those as materials to grow vaccines on. And so we then developed an epidemic of cervical warts, cervical cancer, for which we are now shilling yet another vaccine, which causes more warts and more cancers. But those are the warts we're talking about, the uterine warts, the cervical warts, the labial warts. Go away. Thuja leads all medicines for symptoms coming from suppressed fig warts. They look like figs. Preeminently strong medicine when you have a trace of animal poisoning in the history, such as snake bite or the smallpox vaccination, which was the only vaccine back then. So this was one of the first remedies that Hahnemann developed, and it is actually far more relevant today than it was, 150 years ago.
May I say something?
Please.
Because I know it's cool in here. And you get much warmer if you open up instead of close up and breathe.
I'm just looking at my fingers.
Yeah.
I've got the Raynaud's disease.
Yes.
But definitely breathe.
Okay.
Breathe. And,
All right, case number 3. This was more magical because it happened to me. I was gardening and I was dumb enough to fill this thing with dirt, and the whole thing landed on my calf. Yes, that's not my leg. My leg was a lot more purple than this leg. The back of my calves was black and blue, and the blow just about felled me. And so I hobbled over to the cabinet, I have nothing else, and took some Arnica, and it was like magic. So the more acute the problem, the more dramatic the remedy, I'm finding, especially in homeopathic remedies. And so it went away, and I was on the floor, I couldn't get up, I was in so much pain. I then took the dogs for a long walk, and then 20 minutes later it started hurting again, so I took another Arnica, went down again, and then it got better. Not a mark left on my leg. Yes.
so one other homeopathic that's really wonderful in that situation is rescue remedy.
Oh, yes, yes.
Always have some on hand.
Yes, yes. And Tromiel also?
Well, rescue remedy is for the emotional body.
Okay.
Or,
Okay.
to get you the flowers.
A Bach, yeah, the remedy flowers. So that's case study number 3. You know, this was not a randomized control study, but let me tell you, most of the randomized control studies are fraudulent, as they have determined. You know, fully 70% of all these studies are made up by pharmaceutical companies or, you know, people that have a vested interest. So they will go to a graduate student who is really poor and say, dangle a $100,000 check and say, I want this research, and you know what I sell, right? And so the answers that come out are frequently in favor of, such as statins, blood pressure medications. Most of these are modern inventions concocted to create a, 30, 40, 50 million person market of patients that never existed before. So with respect to blood pressure, in the old days, it was 100 plus your age over 80, considered normal. So if I'm, say, 60 years old, it would be 160 over 80, perfectly normal. And people whose blood pressures went up as they aged actually lived longer. What we're doing now is we're medicating it down to 100, 120, and these people are dying. They die much faster. They have more cancer, more depression, more suicide, more violent deaths, more accidents. So because we've created a market, because that grad student got his funding, with all these fatally flawed so-called double-blinded studies.
So if your blood pressure is low by nature, is that okay or not so much?
If it's very low, then you want to eat a diet that makes your blood pressure
Like
good
120
for.
over 80, 120
That's
over
okay.
70.
That's okay. If it was 90 over something,
It's
very I would be worried about it. But feel free to eat lots of sea salt.
What did you just say is the number then? 120 over, what did you say?
Oh, 120 over 79, 120 over 80.
Oh, that's okay.
That's,
Mine tends to be very low also. Mine tends to be 100 over 60, 65 something. But that's normal for me.
okay.
And I eat a lot of salt. I have a salt craving, which is what my body tells me, and I do it. And so, I feel very well. So the key with blood pressure, the key with cholesterol levels is, if you were to not believe anything anyone says, is to look at yourself and say, how do I feel? Did I feel like getting out of bed today and going for a walk, or do I feel so fatigued that I'm sitting there with the covers on top of my head? And if you are well, then that means you're healthy. That's a sign that you're very healthy. So anyhow, for me, this was very eye-opening. I did it for the dogs because I didn't want them to go to vets and then be forced to take shot after. They're giving flu shots to dogs these days. So I just didn't want to deal with all that. Anyhow, so it's magical when you have blunt trauma, no bleeding, internal bleeding, when you're in an accident where the steering wheel hits you like that, or the bag hits you, or you have whiplash and all those kinds of aches and pains. And that is Arnica montana. And strangely enough, Arnica montana is very good for the heart. It helps the heart muscle work better. It helps clear angina pain. So if you feel you're about to get a heart attack and you have no other medication, eat an Arnica. And it'll reduce the angina pains, chest pains, heaviness in your arms, or aches in your shoulders, and so on. It's a well-known remedy for heart-related problems as well.
And takes shock out of the system.
It'll take shock out, but there's a better remedy for shock. And everyone should have that, and that is Aconite. So within 24, we're all gonna be exposed to shocks. People we know are gonna die, accidents, we get into traffic accidents, things happen to our children, and when that happens, eat an Aconitum 200 or 30C or whatever you got within the first 24 hours of the trauma, and you won't even go there.
How do you spell it?
Aconitum, Aconitum napellus.
And all the stuff is in this box.
All of that stuff is in this box, but not every single thing.
Yeah,
There's
yeah.
only 100 remedies in this. But so we're going to talk about things everyone should own and have. What you don't want is you have an accident and then you're scrabbling around on Amazon looking for a remedy, and it's going to take 4 days to come, by which time it's too late. So there's some remedies everybody needs to have in their kitchen cabinet. Keep them away from microwave, cell phone, sun, etc. Good for you. These are the Banerjis. These are people that I admire a lot. India embraced homeopathy like no other country in the world, and today, easily 100, 200 million people in India use homeopathy primarily as their mode of treatment. This guy is Prasanta Banerji. He passed away last month. A wonderful, wonderful family of homeopaths who have been practicing homeopathy for the last 150 years. Like right when Hanuman developed it, some German missionaries brought it to India, and his, I think, grandfather or great-grandfather, Vidyasagar, looked at it and said, there's something to it. And he practiced homeopathy as a hobby. And he encouraged, he encouraged his, I would hug you, but there's this fire in it. Virtual hugs. So this guy's grandfather encouraged his children to become homeopaths. They were all MDs and became homeopaths and have been practicing for 3 generations now. And boy, do they have a record, because they were ridiculed. When allopathic medicine kind of took off, they were thought of as fools. And what they have built is a database of, I think, 20,000 cancer cases alone at the Banerji Clinic. And they're testing their protocols at the MD Anderson Cancer Research Institute. Lots of collaboration going on. And they have some very, very good cancer protocols for every kind of cancer that they have had phenomenal success. And the success rate is way better than chemo and radiation. And they have particular success with brain cancers, liver cancers, stomach cancers, and so on.
The clinic is in
Colon
India.
cancer. It's in India, it's in Calcutta. And they see 1,200 patients every day. About 200-300 of them are cancer only. And they have, so what these people do is they'll get their MRIs. They will get their brain MRIs from the local hospitals. And then for treatment, they don't do radiation or chemo. They come to the Banerji clinics. And they treat about a quarter of these people for free, by the way. And they have done it for 3 generations. And so they're saints, yeah.
Workers can make it because it's expensive.
Yes.
Everybody can afford it.
Oh, absolutely. And they can't afford it.
We can hear that.
She said the standard therapies are unaffordable for most very poor people who have no insurance. Who can afford chemo and radiation and surgery? No, very few.
Even if you can afford it, who wants it?
Who wants?
Yeah.
Yes. So we have a lot of fresh evidence that indicates the curative powers of like curing like, for very, very intransigent and very, very chronic diseases that we see in our civilization today. And there's things that you should know, constitutional versus acute. So there are some things, say someone got the flu and you gave them the same remedy that you gave to your entire other family, but they didn't get cured, or another person didn't get cured. And Hanuman wondered, why is it that they're not getting cured? And he made the distinction between people who were otherwise healthy and got an acute disease, as opposed to people who had, cancer or other miasms in their families. And back then he had these three miasms: the psoric, the psychotic, and the syphilitic. And the psoric was the tubercular miasm, the psychotic was the gonorrheal miasm, and the syphilitic was this, because that's what he knew. Those were diseases that were passed from mother to child and all that in families. And so now we have the cancer miasm, which they say is the combining of all three miasms. So for these, you have to give very specific constitutional remedies that are peculiar to that family or that miasm or that type of disease or that type of genetic structure. The good thing about individuals learning homeopathy is, who knows your husband or your child better than you? You know your daughter better than any other human being knows her. You know what side of the bed she sleeps on, what side her headache was on, and those are things a homeopath can never learn unless they took a deep case intake. Or if someone has known you for 5 years, I know exactly all the things that have gone on with you for the last 5 years, but a fresh doctor is going to have a hard time with those. And so it behooves us to sort of hold hands, if we will, and treat ourselves and our families, and have long-term results that are especially not confounded with side effects. So my daughter took antibiotics for a UTI, and she knows I object, and she didn't tell me. My other daughter told her sister spilled the beans afterwards, and I'm going, oh my goodness, it's like bulldozing your internal forest. Even in a month, not even in 10 years, will some of the sequoias grow back. And so you're doing something far more chronic to yourself to deal with an acute illness than you need to. Hey, hi! Let me give you a hug. I'm on this side of the wire. Welcome. I have a remedy for you today.
I like what you just said, because many times I've been, how do you explain to someone so they have a visual picture? You're clear cutting your bacteria when you keep the antibiotic.
Exactly. You are clear cutting your forest, and now 3 months later you're going to get another round of UTI, and it's going to get worse. And then it'll turn into cystitis. But you got to be gentle with your own children, and I think you do this gradually. And so I introduced my daughter to Thuja, and it had a remarkable effect on her. And now she's kind of sold. And the next go round, she'll be less inclined. So it's a slow sort of learning process, but it's very powerful.
Can I ask you a question? Mm-hmm. So on the constitutional, like I have a certain constitutional.
Yes.
Always.
It
doesn't change no matter what.
Exactly. Okay. And that's the key. That's a very, very key point you made. And so therefore, your constitutional remedy is the one that's going to work for you for pretty much every condition that you have.
And does that enhance the other remedy that I'm taking?
You don't even need the other remedy. So what remedy was required for the acute without that constitution is not going to be required. It's your constitutional remedy that will make you well. And that's the distinction that you got to make. But don't freak out. Don't get stressed out by that, because these are very easily learnable things. And you're all super, super smart people. You're very, very smart. The key is to be very organized. And write things down. Because I know I forget. I forgot when my daughter had her infection. I forgot what exactly we did. I forget temperatures that children reach. And those are things that you want to remember so that you can always do comparison testing. So 3 weeks ago, the pain level was a 10, and now it's a 6, and the person is not even mentioning that pain. That means there is improvement, and we should carry on with this remedy. So keeping notes is key. Acute is for all sorts of short-term ailments. Acute means diseases that come on fast, they come on strong, like the flus and colds and coughs your children are going to have, infections, or they fall down and hurt themselves, and then they're gone. Those are acutes. Constitutional is where, your mom had this disease, you have this disease, your children have the same issues. That's constitutional. And it becomes very easy to deal with constitutional if you know what worked for you. You just give the same thing to your kids and to your grandchildren, if the circumstances have not materially changed. So that's the difference between constitutional and acute. And for women with children, this part is so critical and so essential that you can't stress it enough. If a child falls down, if a child gets bruised, if a child breaks open their skin, or a nail gets driven into their foot, the first thing us mothers do is go to the doctor. But we don't need to. There's homeopathic remedies for all of that. They cost about $5 to $10. If you're in Europe, they cost $2 a piece. And if you have 10 of these remedies, you can administer them and know that the child will get better almost instantly, miraculously, and very fast. And you're saving, how long do you sit in the ER these days?
6
hours.
6 hours? 6 hours.
And you're exposing yourself to
Exposing yourself. My daughter got a $5,000 bill from the Zuckerberg Hospital for administering an antibiotic.
Oh my God.
Yeah. I mean, they do these things, and think of the time you waste sitting in doctors' offices, that you could just, boom, take this, you scrape your knee, take hypericum, you got hit with a hammer, take Arnica, oh, you're shocked because your buddy left school or something, give them Aconite, because children go into depression just as we do.
So is muscle testing or,
Yes.
used to make sure that you're, this is
The right, yes,
remedy
you can,
at
yes,
this time?
absolutely. You can use all sorts of methods to make sure it's the right remedy. The best thing you can do is write it down. I had a migraine, which was caused by, not me personally, I'm pretending to be a person, by changes in barometric pressure, because I live up by the lakes. And every time the pressure changes, the clouds go from cloud to sun, or the snow clouds cover, I get this huge migraine that starts on the left, goes across my forehead, and turns into a nightmare. Calibicromium, or sanguinaria. You take it, the first time, you take it very frequently. The next time, you will notice that the intensity of your migraine's gone down, and the third time it's cleared. So that's how powerful some of these remedies are if they're applied right.
Is there a standard dosage for these things?
There is for you. You want to take the minimum dose that's curative. So there's no such thing as, some are very sensitive, and a 6C or a 1C or a 3C dose will suffice, whereas for some, and especially for chronic disease, you need a larger dose.
And does it
Larger
say on
quantity.
these little labels and stuff?
Yeah, they're all 30C, and there's about 9 of them that are 200C, and it'll vary by person.
So is it true? I remember when I first was getting into homeopathy that I was told if you take a remedy when you don't really need it,
Yes.
you get the symptoms.
Yes,
of what
yes.
it's,
Yes, and you
get
will
the
know.
symptoms of what it's supposed
Exactly.
to take
Cure.
care of.
Yes. And that is called a proving. Yeah, so that's how they proved these remedies. That's how Hanuman took quinine, the malaria medication, and proved it on himself. And he got every single symptom of malaria, the shivers, the jitters, the fevers. And that is like curing like. And that's when his light bulb went off. He says, holy shit. Shouldn't say that. Life cures life.
He might have said that.
In German, yes. Macht, yes.
Yeah.
He wrote that in his 7 languages. But that's where, and Hippocrates said it too, only we didn't follow through over the last several thousand years. We've suppressed symptoms. There's more money in suppressing symptoms, by the way. There's not more money in homeopathy. And so there's fewer homeopaths, so it behooves us, moms and grandmas and aunts and women and sisters, to pick up this skill because it's simple. It's very, very simple once you know it. So infections, flus, falls, accidents, etc., all acute illnesses. And so now the practical parts. If you have a shock, and this is remedies I would recommend everybody have in their medicine remedy cabinet. Aconitum napellus. You hear bad news. A friend of yours got diagnosed with, a childhood friend got diagnosed with cancer. You can't sleep, you're in shock. Your husband just met with an accident. Your child was, in some foreign country and is taken sick. You just had an accident. Aconitum is your remedy. You take it within 24 hours of an acute illness or shock. And everyone should have it in a potency of 30, 200, and in some cases even 1,000,000, depending on what the shock is. And what this is doing is, it will take away the ill effects of shock. There are people who have, from the shock, died. They have heart attacks. They have keeled over. That's when their chronic degenerative disease began, that day when the shock happened. So fright, shock, accidents, bad news, cardiac arrest, sudden fevers, high fevers, bad news, death of a loved one, happens to all of us. Everyone should have aconitum. Violent injury, my daughter got mugged a few years ago, and at that time she should have had the remedy. She was in shock for several days, and so now I have given her a bunch of remedies, and at least she can call and say which one should I use. But she saw stars. This homeless man came and whacked her, and she was traveling the next day, and she was in great shock.
Could you explain the potencies a bit? What's
Yes,
the difference
yes.
between those
So
two?
generally speaking, a potency, these are in increasing order of potency. 30 is the least potent, 200 is more potent, and 1,000,000 is very potent. So for most people, 30C is okay. If it's a less potent dose and you still feel shocked, you can take it every 15 minutes. You can take it every half hour or every 2-3 hours. Or if it is for a bigger shock, you take the 200. If it is a super, very, very, very big traumatic event in your life, I would go for the 1,000,000. And especially if you have some kind of chronic illness, you're liable to be divorced. Is aconitum. Divorce is aconitum. Yes. And how many women do you know who run around in shock? Yeah. Yes. Absolutely.
And how, you say within 24 hours?
Yes. Within 24
If
hours.
it's later, it's not.
You're shocked. The effects of the shock have set in. You're vomiting with fear. You have profuse sweat. Okay. You've increased urination, thirst. Your face is flushed. You get fired from your job, or you get walked out, or things happen. And that's when you need your aconitum. Fear and anxiety, constant pressure in the left chest. You feel you're coming on with a heart attack. You have sudden onset diarrhea. You have cold hands, hot hands, nightmares. You have anxious dreams, cold sweats. That's aconitum napellus. And so on the left-hand side is the name of the remedy, and on the right-hand side is sort of the repertory. I've shrunk it a little bit. If you read repertories by different people, they're written in different tones of voice, and they're pretty cool. It's like reading a novel. So you should read those. By the Banerjis have their own repertory. The current homeopaths have their own repertory. Hahnemann had his own. Kent, Henning, they all have their own descriptions of how this looks, and aconitum. So everyone should have this.
So do you think this brings you more into the parasympathetic?
Yes, exactly. Yeah, that's such a good point. This brings you into the parasympathetic mode. And beta blockers are basically hard drugs that bring you into parasympathetic mode. But look at the side effects. The side effects kill you. This is a beta blocker that is far, far superior. This will keep your heart attack from killing you. And it's nothing. It's like $5-10. For the price of $5-10, it's even cheaper than insurance. Arnica, Montana, after injury. blunt trauma, black and blue marks like my leg was, huge sudden muscle aches, flus, chest pains, traumatic injuries, and you should have, this one I would recommend you have the 3 potencies for sure, 30, 200, and 1 million, because you're going to use them. I can almost guarantee you'll use them. My partner Richard digs, and sometimes he, at the end of the 3rd hour of digging, he'll dig and swear, and then he'll accidentally hurt himself, and then he's really ruined for the day. That's an arnica. If you hurt yourself badly, black and blue marks, or you throw the shovel on your foot, traumatic injuries, gout, black and blue skin, falls, blows, concussions. Like my Seema had a concussion, and I should have given her the Aconite right away and kept an Arnica montana 200C. You know, in the city of San Francisco, it's dangerous. You can get, people get mugged all the time. Venous taces, tendency to internal hemorrhage, strains, varicose veins, tendon, ligament, muscle injuries, sprained joints, soreness, post-labor, and you're sore from having a baby. Katie got tons of Arnica, and it really helped. Sore nipples, mastitis, angina pectoris, little known use of this remedy. The first sign of a heart attack, you've got nothing else, you're breathless, you're hurting, pop a couple of Arnica, a Arnica. And the dosage is 1 pill. Dosage is not 2, 3, 4, 5 pills. It's just the tincture that's poured into these things, and they'll say 2 or 3 pellets, but you can take as little as 1 pellet, and it'll have the same effect.
Are there different types of arnica?
No, they're just made by different firms, but it's the same Arnica montana. It's the North American cedar, and it's and so instead of taking them to a doctor, there you are, you have it, and the kid will literally start playing 10 minutes later.
So for varicose veins, you mean if they are sore, or just if you just have
Sore, bruised, black and blue, and if you have heaviness in your legs, that sort of thing. A cardiac dropsy with distressing dyspnea, extremities distended, lower. Some people have their left leg swollen, some have their right leg swollen. So hypertrophy of your heart, swelling of your heart, swelling of your legs. Arnica is great. There's no side effects. It does not do harm. It's a great remedy to have. And I would recommend people keep it in these 3 potencies. For minor things, you do the 30, and you do the 30 as and when you have pain. 200 for the more major things, like if your husband or spouse has a heart attack, give them the 200 or the million. Oh, this is, I did. No, this is all good. It's all
Can you
good.
take it daily?
You can for certain things. You can take it for certain things. If you have soreness and bruising, but you want to look at a constitutional remedy if it is a regular matter, your aches and pains. But you can without problem, without harmful effects.
Again, can I ask, some of these tablets are so minute, you just take one of those?
I take just one of them. I take one of them. You can take 2 or 3. And I would recommend you don't buy those small tablets. You might, because you won't be able to see them. You need glasses.
Homeopathic, I couldn't believe them. I didn't know what to do with them.
There it is.
Those are the bigger ones.
Okay.
So these are the size
Smaller
15.
than a
Oh,
bird seed.
I
Yeah.
don't know how they've been
So
made.
those are poppy seeds. These are mustard seeds, are a little bit bigger.
Thank you.
And then the bigger ones are the BB pellets. And if you can't see, like our dog Roxy can't see them because she's so old. And so I have to resort to all sorts of trickery and put it in food, which I shouldn't, but that's how I'm trying to get her to eat.
Sprouts has 20% off on boron brand.
Oh, who has?
Sprouts.
Oh, great. Awesome. There you go.
Sprouts.
20% off on boron brand.
That's what this brand.
So everyone should have an Arnica montana. And you got to make your own kit. Like I got this because I have kids in 2 different parts of the world, and I live in the back of beyond where we're not readily going to reach medical attention, and I have 2 dogs, and a grandchild, etc. Lacerations and wounds. So if your bruise opens up, if it bled, then hypericum, and hypericum also is a great remedy for open wounds, 30, 200, and 1 million potency. If you got punctured, if you're on a farm and a nail went up your foot, anything that causes tetany, ledum pasturi, and again, I would say at least get a 30 and a 200, if not a million. A 30 should be okay, actually, because how often are you going to get stung by nails? Unless you're barefoot like I do. I once barefooted in San Francisco, land of drug needles and glass, and I got glass in my. For that sort of thing, a ledum with a potency of 200 might be indicated. So these are puncture wounds from functional pain to altered secretions and deposits of a solid earthy matter in the tissues. So that's how beautifully they described it in the old days. They didn't say nail. They said deposits of solid earthy matter in the tissues. The ledum, rheumatism, begins in feet, travels upwards, affects the skin, producing an eruption like poison oak, antidotal thereto, as well as to stings of insects.
Oh, yes.
So insect bites, when your child is running barefoot and they get a stinger in their foot, ledum, or a shard of glass or a nail. Stings of bees, needle, rusty nail punctures, worse from. And let me tell you, DPTs, every time you take a child with a nail in their leg and their foot to the hospital, what are they going to do? They're not going to, they're going to give them a shot, and it's not just tetanus, it's D, P, and T. And children have gotten so damaged from these shots, you don't need to.
So, just to understand it better, the 30C is the lower dose.
Yes.
But is that because the 200C has been diluted 200 times?
Yes, yes.
And the 30C only 30 times. The more you dilute,
The more potent
the more potent it is.
Yes, that's a good point. Yes.
It's the more energetic and the more emotional
Yes.
as well.
Yes, and it'll go to a higher and higher plane. In homeopathy, they say this is the most important part, inside to outside, and the body tries to protect the innermost and the most important parts most. So you frequently find things starting with acne and psoriasis or eczema, and then they go internally to your organs. And so the cure, similarly, is in reverse order. And so, but the body tries to protect the most important organs the most. So ledum, anytime puncture wounds, you squeeze the foot or the toe, get the blood out, give them a couple of doses of ledum. If it's bleeding, give them some hypericum too. But ledum will make the injury non-infectious. Ledum is great for surgery also, where there's going to be cuts that you're going to have. Lachesis, menopausal. How many women still have hot flashes, hormonal issues at menses, or in preparation for menopause? They have joint pains, they get, bleeding, pre-bleeding, leukorrhea, this, that, and the other. They get mentally foggy, confused. Lachesis, if you have, and lachesis is great for acne. That is right before your periods, right after your periods. It works like magic. Lachesis 200C, and I'll come to that remedy later, but Lachesis 200C, morning and night for about 6 weeks, and if you don't notice a difference, email me or text me. Lachesis 30 is great for menopausal, like you get up at 3 in the morning, and there's different remedies for different times of waking up. 1, 2, 3, 4, 5, 6, 7. There are people, I tend to, post-menopause, have woken up at 3 o'clock with feelings of anxiety and problems